Why do some blood pressure medicines make people cough? ACE inhibitors are commonly used to treat high blood pressure and heart failure. They work by blocking an enzyme called ACE, angiotensin converting enzyme. This lowers the amount of angiotensin II, helping blood vessels relax. But ACE has another important job. It also breaks down a chemical called bradykinin. When ACE is blocked, bradykinin builds up in the body. The extra bradykinin can irritate the airways, causing a persistent dry cough. That's why some patients taking ACE inhibitors develop a dry cough. Follow MedSynoptic for simple medical facts.